trained from Dr. Dinesh Chouhan, Dr. Sankaran, Dr. Gaurang, Dr. Praveet Garg, and she's the founder of SAMRAGEE Homeopathic Clinic and practicing at Indore. And within a short period of time, she running her practice with a huge number of successful cases. And her successful cases and articles are published in a journals like National Journal of Homeopathy and homeopathy.com and book.com. And we are very delighted to have you here, Doctor, and welcome from IHMA, and take over the session. Thank you so much.
Thank you, Dr. Anupriya, for your kind words. Okay, so without wasting time, I'd like to start the session. A very good afternoon to all of you, all the participants. As today's topic of my is group study of Kali and Calcarea group of remedies with case derivation. So at the starting, I like to start presentation with the cases for the further understanding of group remedies and the practical presentation of patients of both the groups, how they talk, how they behave. So let's start with the first case. I request all the participants to participate in the case and just try to analyze and find out the remedy. We will discuss after the case. Okay, so we'll start with the first case of today. This is a case of omentum hernia in a 25-year-old male patient. By occupation, the patient is a carpenter and he is a student of 5th standard. On USD, by USG, the omentum hernia is left inguinal region is presented there. And actually, this case is of surgery case. So surgeon's opinion is to do the laparoscopy as soon as possible. But the patient doesn't want to do surgery. That's why he approached to homeopathy. So let's see the chief complaints of the patient. What the complaints for which the patient is consulted me. The foremost and the important complaint is there is a pain and swelling in the left lower abdomen since last 7 to 8 months, which is aggravated by cycling and lifting weight and amelioration by rest. As I told, the patient is carpenter by occupation, so lifting weight is a part of his job. And he used to cycling daily up to 7 to 8 kilometers to reach for work. Another complaint is of tinea corporis, that is since last 2 months is on the buttock area. And the only complaint is the itching, which is aggravated at night. He has backache since last 6 years, which is aggravated by bending down and weightlifting and emulated by rest only. Since last 2 months, he has some small pimples on back and there is a lot of itching is there. If we talk about the nature of the patient, what he narrates about himself is, I can't believe on people easily, as what he thinks that people are supposed to cheat. He can't tolerate the liars. He can't tolerate liars. That's why he doesn't believe on people. He's like, whenever I got angry, I used to silent that time. I like to be alone that time. For the patient, the family is the foremost and the very important part of the life. He feels happiness with that. Without family, there is nothing for this patient. And he always needs people surrounding him. He likes that. He is very hasty in doing work. He is doing work very fast. And he is very punctual for the time. If the time of his job is 10 p.m., so he is never going to late for 5 minutes even for the job. He is that much punctual for the time. He wants clean. He wants things very clean and very proper. He said, I love to do hard work and I love to earn money by hard work only. He gives an example like if I got a money on road, I'm not going to pick it up because this is something what I got in free, and I doesn't want. I'm not going to digest the free things. So he is that much principled in his life. He is very conscious about his health. Every time whenever he is visiting me for the follow up, or in the first visit, his persistent question is, doctor, is my problem is treatable? Is I'm going to treat or not? Is it my problem is something like that, my life is in problem, is I'm going to die or something? This is the main concern every time of the patient. If we talk about the lifespan of the patient, his mother died 6 years back after a long illness, and he have three siblings. After the mother, he is taking care of all the siblings, of work, of home, of cooking, and of father. Everything, every responsibility he fulfill after the death of the mother. Patient has started working very early stage of his life. At the age of 11 years, he started working because the financial condition of the home is not good. So to support the family, he started working. If we see the family history of the patient, father had tinea corporis, mother expired after paralysis attack. The paternal grandmother and the paternal aunt both have the cataract problem. One uncle have renal calculi. Both the paternal aunt have asthma. And brother, he is also my patient, is have inguinal hernia. And a sister of his is expired 5 years back because of the brain. In generalities, there is a peculiarity of sweet desire. He desires sweets a lot. He is a chilly patient and a thirsty patient. He likes to have cold water. There is a scanty perspiration, but whenever he got to perspire, he got perspiration in axilla only. On physical examination, what I found is swelling in the left inguinal region. There is pain on touching. If we see miasmatic understanding of this case, so the patient is in the soric and psychotic miasm, where the psychotic miasm is predominantly present here. So this is all about this first case. I like if participants are putting their views, their analysis, and their remedy suggestion for this case. Uh, Dr. Anupriya, can you please read if any suggestion is there on chat box?
Yes, doctor. So, participant, if you have any suggestions, please put in the chat box. We have suggestions like Kali Iode, Kali Card,
Mhm.
Kali Group, Kali Ars, uh, and Kali Card. The same repeated medicines. And I have some suggestions like duty conscious, ambitious, conscious, and the remedies Kali Card. And physical appearance of the patient, I think she asked the question. So maximum are Kali Ars, Kali Group medicines.
So let's see the analysis first. Then we talk about the medicine. So if we see on mental level, uh, the important things what we found in the case is he wants things very clear, means he is fastidious, he is hardworking, he doesn't believe people easily, he is very punctual, he is very principled, he is suspicious about the disease, and there is a lot of fear of death there. On general level, there is sweet desire, chilly, and thirsty person. So on the basis of the analysis, if we pick up the rubrics from the repertory, so my rubrics are suspiciousness, mistrustful, because he doesn't believe on people easily. There is a fear of death. He is fastidious. There is a lot of anxiety about the health. He desires company, and there is a for sure the sweet desire is there. And if we put this rubrics on the repertory chart, so we got in repertization chart. We got so many medicines which cover whole the rubrics in very great number of marks. So on the basis of the indication what we found in the case, I prescribed the Kali Rs here. Let's see why Kali Rs. So if we see in the Soul of the Remedies by Dr. Sankaran, the main feeling of Kali Rs is that the people, those whom the patient seeks, cannot be trusted. They could even rob him. Like all Kali remedies, he seeks the support of the family or of the group. Without them, he is weak and dependent. He needs his family and his harmony and integrity become his currency. So he become caring for the family and supports them and take good care of them. This is what we found in our patient. If we see further in this again in Soul of the Remedies, he's extremely anxious, makes him highly organized, fastidious, careful, and cautious. He is extremely anxious about his health too, so anxiety that he cannot trust even his physician. In Fatak, what we found, chilly and sensitive to cold, cannot get too warm even in summer season. So as I prescribe Kaliars, so why not the Urs, Lycopodium, Pulsatilla, Nux, Phosphorus, other remedies which are stand first, second, third, or fifth, sixth stand on the repertory chart, which also indicating so much high in this periodic table. Sorry, in this repertory chart. So let's see why not these remedies. So if we see in the arsenic, what is the main feeling is there is a main feeling of insecurity. The arsenic patient sees the world is threatened, there is chaotic, his life is full of anxiety, he is extremely fearful that he will lose what he has unless he is extremely cautious, which is not be found in the patient. And if we see the lycopodium, the main feeling is that the person remains small. uh, he 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 feel that he will be nowhere. He feels that there is no power. The lycopodium is very cowardized person. This is not there in our patient. If you see in pulsatilla, so this is the very different thing. Pulsatilla, the main feeling is of the softness. uh, Pulsatilla feels that for the survival, he need to be gentle, to be soft, and not too hard and rigid. And if we see the Naxomica, so there is a very resemblance in the Lycopodium and Naxomica also here. Uh, so and there is difference too. There is the difference in the clothes, but the main difference in the Naxomica is the cowardized inside. He is more rash and audacious, more forceful and expressive, which is not there in our patient here. And the phosphorus, which is very sentimental, very affectionate, very sympathetic, which is for sure our patient is not. So no doubt the prescription is of Kali Rs. But why the Kali Rs? If we understood by the periodic table, so what we found in this particular case is the theme of a middle kingdom. And what we found theme of as a theme of middle kingdom here is as the support, is the relation between, as the security. There is anxiety for health, and there is uh, this all qualities of the case represent the middle kingdom here. And in Mindal Kingdom, specifically, row four qualities are there in this patient. That is the hardworking and he is very family oriented person. So the prescription is Kalias 1 m single dose. So let's see uh, what happened after the arsenic album. Before that, I like to move out to suggestions of the participants. Someone suggesting the uh, Kali iode. So first thing, Kali iode is the hot remedy. And the main feeling of Kali Ayad is he may be betrayed or stabbed in the back. This is the something which is main feeling of iodine. So iodine is not there. So let's see the follow up after Kali hours. After a month of follow up, after a single dose of Kalias 1M, the pain and swelling of the left lower abdomen is slightly better only. And the itching of tinea is as it is there. Backache is 10% better. Pimples on back are there, but there is no itching is there now. And the very important and the positive thing what I found in the first follow up is patient is mentally feel relaxed and there is not anxious much anxiety about the health now. So as on the physical level we doesn't got the desirable or some markable result. So I repeat the same dose with the same medicine, single dose again. And in the second follow up after another month, what I found is there is pain and swelling in the left abdomen is up to 20% better now. Backache is 40% better now. But tinea is slightly better, not significant result still. But there is pimple is there, but still the itching is not there on back, and mentally the patient is feel very calm. Again, the positive sign. Another follow up on second follow up also, I repeat the dose of 1M Kalias. On third follow up, the pain and swelling on the left lower abdomen is up to 50% better now. In itching also, he got much better. Backache is 90% relieved. There is no pimple on back now, and he feels like I'm become well soon. The first time from starting of the treatment, first time he told that now I'm feeling that I will be better, because every time he was so anxious and he was like, is I'm going to better or not. So again, still the problem is 50% there. The main problem of so I repeat the one dose again. And on the fourth follow up, the pain and the swelling is 90% better now, and all other problems are not there. And there is 0% anxiety is there. Patient feels so relaxed even in talking. So this time I doesn't repeat the medicine again because all the problems are almost better, and the chief complaint of the foremost, the main chief complaint is also 90% better up to there. I put keep patient on SL only now. And in the another month, there is pain in there in lower abdomen, but it's not daily now. It appears sometimes and rarely once in a week a period is there, and that is also for a short period of time. And even after cycling, because he used to cycling to reach to the job, so he is unable to leave the cycling and lifting heavy weight because that is the part of his job. So instead of all this thing, the problem is very better now. And all other things are better. The anxiety about health is not there now. He feels mentally very relaxed and calm. So this is about the first case. Unfortunately, I doesn't have before and after report. I missed that, so I doesn't show the before and after report right now. So, is any question related to case 1 year?
Doctor, we have question regarding doses. Somebody suggesting why it's why 1 M potency and why not 30 or 200.
Okay. See, usually 30 potency we prescribe when we are doing the pathological prescription. And what I did is I prescribed as a constitutional medicine after the case. So I'm not prescribing on 30 potency. And if we see why not the 200 potency? So when the case is of a mental level, means the mind is 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 majorly a part of disease there. So that time I usually start 1M potency, and if we see the 7 level of experience of by Dr. Rajan Sankaran, so he described there about the potency, when and what potency we have to prescribe. So that's why 1M potency I prescribe here, because with the physical symptom, the mental level and the mind is also similarly affected. That's why I start with 1M potency and not the 30 and 200.
Okay, ma'am. Then why when to advise USG again?
See, if when we feel the physical symptoms are reduced, when we see the physical symptoms are 50% or 90% reduced, or patient feel like the swelling is not there, pain is not there, then you can advise the USG again.
Okay, doctor. Then we have questions. What are the indications of psychotic miasm?
Okay. See what we found in the case, as I show here.
Okay, you can take
The suspicious net, the fear of death, the suspiciousness of it. This thing represent the psychotic miasm.
okay, doctor. Then we have questions. Reason for left lower abdominal pain.
Reason is the omentum hernia. The pathology. Reason is the pathology.
Okay. Why medicine was repeated after a month? Why not given earlier? Why waited for a month?
Okay. Because see, usually for the repetition, we just wait ki the patient is come for something, some significant with some significant result. For in first follow up, what I'm waiting ki for a month, I give a gap of for a month after first dose, because I want to confirm that the medicine, whatever I given to the patient, is right there. And how we can come to know the medicine is right, when patient is come and in follow up he narrates that what the changes he feel and what not changes, whatever the reply of the patient. On that basis, the further treatment is depends. So when in first follow up, I got ki some percent of relief is there, but still the progress is not so much high. That's why I repeat the dose again. And when I got up to the 90% of relief, then I put patient on the SL only, and he got better after with SL only.
Okay, doctor. I think it's clear. No more more doubts. I think someone is asking for duration. So doctors, you can well understand about the durations of actions and all. So, ma'am, we can move in the next case, I think.
Okay. So today I'm going to two cases only, and after that we are going to start with the group study of Kali and the Calcarea. So the second case, this is the very simple case. There is not any significant pathology is there. There all the reports are normal there, but still there is a swelling on leg. So this is the case of a 40-year-old female. She is widow, and she is doing job in MBEB. The chief complaint is there is a swelling in leg, which is there since long back. Since last 12 years, the swelling is there, specifically on the ankle region. And he feels heaviness and pain in the leg, which is aggravated by sitting, as she have a sitting job. So after that, at the evening, the swelling is so much there. The other complaint is he have left leg pain after injury. She fall in the ground of office 1 month back. So there is a pain which is aggravated by walking and standing up, and she feel better after massage. She want to lose weight. When she come first time to me, the weight is 79 kg, and she said ki because of my second job I put on my weight. Another complaint is of constipation since long back. Even she doesn't remember that how long she had constipation there. There is an unsatisfactory stool, there is hard stool, and she have to put so much pressure to pass a stool there. No any other modalities there. She have in the last complaint, she have a white-headed pimple on the labia majora since long back, which is repeated in every 6 months, and which oozes the white discharge and which is painful sometimes. When I ask about the lifespan of the patient, see how systematically and with year and date and time she is explaining everything. She said, I got married in 1995 and I was housewife that time. I'm not doing job that time. And in 2005, on 2nd of October, on 11:55 a.m., my husband expired in a road accident. And she had 3 kids at that time, which are very minor. I have to fulfill my responsibility now, what she is telling. And there is a feeling that why God did this to me only. Why me only? And further, what she explains ki in 2006, I studied 12th standard after her husband expired, and in 2008 and 9 he did diploma in the computers. In 2011, she did BA, and what she said in 2017, I achieved what I want. Means she got job there in 2017. So during the study, when she is studying for earning, she is doing that sewing work. She is preparing, she is making the dresses and all for the earning, for the fulfill the requirement of childrens in the home. And at that time, people are used to laugh on me, and they're like, "Why I'm studying? Why I'm not doing some small work and fulfilling my children's requirement and all." When I ask when she lost the husband, what was the main, what was the reaction, and what was the feeling first time when she heard the husband is no more now? So what she said, I lost my support. What I felt first time when I heard that my hubby is no more, and he was the big support of my life. So I lost my support, and after he died, my in-law family is also not supporting me. On the job, in the job area, what she described that she have a fear that what people will say if she took lift from a male colleague of her. So every time she, instead of the pain and the swelling of the leg, she used to walk 4 to 5 kilometers daily, because just because if someone saw me that I'm taking lift from a male colleague of mine, so what people will say. This thing is very important for her in her life actually. That's why she's not doing anything. Means she's not taking lift. She doesn't got married again. So this is the very important thing. What was every time is there in her mind about her childhood. So she is from a middle class family. The father was a carpenter and the mother was a housewife. What she told is, I was very stubborn since in my childhood, and I was obeyed since my childhood. As a child, she have lot of fears are there. There is fear of darkness and fear of ghost, and many things are there in the childhood. Lot of fears are there. Further about the childhood, she said uh, she was not too good in studies. She was not too much friendly. She was timid. She doesn't talk much to everyone. Not responding in the class. There is she avoid to talk to strange people because out of the fear. She doesn't oppose to anyone. Still, she is like that. She is not opposing anyone out of the fear, and she used to talk very less. See about the obstetric and gynec history of her. So she started menses at the age of 14 years, which was regular. 4 to 5 days bright bleeding was there. There is no leukorrhea or any other complaints, and slightly pain in lower abdomen before and during the menses. She had 3 kids, 2 daughters and a son, and all are full-term normal delivery child. She got MTP after second child. If you see the family history, so there is nothing majorly we found in the family history, except mother have DM, and the sister, 2 sisters, have thyroid problem. In the past history, she got typhoid in 5 years back and chikungunya 2 years back. If you see the generalities, there is a desire for sweet and milk. She is thirsty and chilly. There is perspiration on head specifically, and what she got in dream, whatever she is thinking during the daytime, that is only come in the dream, and not any other specific dream is there. On physical examination, what I found, there is a swelling on the ankle joint, and there is that is the pitting edema is there. If we see the miasmatic understanding of the case, the miasm of the case is sora and psychotic, where psychotic is a predominant, and why sora? There's a steadiness of the work, means what she did after her husband expired. Steadily she doing and she achieved what she want. And psychotic because what other will say, there is anxiety, fears, timidity, unable to oppose people. This is that is why the psychotic miasm. So this is all about this case. Uh, Kindly share your suggestion, analysis, and the medicine selection for this case. Dr. Anupriya, kindly read from the chat box.
Yes, doctor, we have suggestions.
Yeah.
We have suggestions of Calcarea car,
Mm-hmm.
and we have some rubric suggestion also, like from
Mm-hmm.
Asparea. Mind, people will observe her condition, elements from loss of protection, sensitive to opinion of others, and elements
Mm-hmm.
from responsibility. And
Mm-hmm.
we have all the suggestions of Calcarea car and Calcarea silicata and Kali borum and all the Calcarea carb suggestions and one Calcarea phos. So Kali carb, Calcarea carb, and Kali phos. These are the suggestions, doctor.
Okay. So see the analysis first, then we'll talk about the remedies. What other will say definitely is the foremost and the most important thing what we found in the case, and the feeling of loss of support is there. There is timidity, fear of darkness. She avoid to talk to strangers. What we found on the mental level. On physical level, there is constipation. She is obese. There is pimple on the labia majora, which is repeatedly there in every 6 months. And on general level, there is a sweet and milk desire, thermally the chilly person, and perspiration of head is there. If we see rubrics according to the analysis, the rubrics are mind timidity, mind fear dark of, mind fear strangers of, head perspiration profuse, rectum constipation obstinate, stools are hard, generalities food and drink sweet desire, and milk product desire. If we see the laboratory chart, what we got is it's the calcarea cup on the first place. So for sure the prescription is the calcarea carb, but not only because the calcarea carb is on the first standing first on the repertory chart, but because the calcarea carb have all the indications of the remedy. That's why prescribing the calcarea carb. Okay, someone suggests calcarea silicata, and the silica is also standing here on the second position in the repertory chart. But in Cilicia, there is a issue of image consciousness. Uh, there is not issue of image consciousness in our patient. The issue is what people will say about me if I took lift from a male colleague. What they will think about me. This is the thing. This is not like my image is going to harm if I took lift from a male colleague of mine. This is not there. So that's why Calcarea silicata is not prescribed in this particular patient. And someone suggests Calcarea fos. Okay, so Calcarea phosphorus is someone who is very talkative. Phosphorus mixed with people very easily. So if Calcarea is combined with phosphorus, so the qualities of phosphorus is also there, although the Calcarea is there. But if Calcarea first person, if Calcarea first patient we saw, they are very freely spoke persons. They are very friendly people. They make friends very easily. So that's why Calcarea force is not prescribed there. So why not other medicines which are covering all the rubrics here in the repertory chart? Why not? So here the Silesia. So see, silicia is a flint crystal and is one of the main components of the glass. So this shows its quality of maintenance, a specific shape and being inflexibility. Means there is a fixed mind is also there in the silicia. Fixed ideas are there. Silicia stand definitely obstinate and try to retain a fixed image they have created for themselves. As I said, the image issue is very important to prescribe the silicia. If we see the sulfur, which is stand there in the repertory chart, so there is struggle for the ego and the honor in the sulfur, which is very prominent there. Ego is one of the biggest theme in the sulfur. As image in the silicia, in sulfur, ego is there to select sulfur. There is lot of embarrassment main feeling is there as a main feeling in the sulfur. Natronium, uh, as you all know, there is a disappointment feeling is there, one-to-one relationship is there in the natronium. That's why natronium is not prescribed. If we see the theme uh, of mineral kingdom, so definitely the structured means the way she is described everything with date, with year, with time, so organized and so exact. This is the theme of the mineral kingdom. They are so exact and so organized. If we see the row four qualities in the case, so she is talk about the task and the work and the family, which is the theme of the row 4 there. So the prescription is Calcarea Carb 200 single dose. And why 200 here? Because again, if we found the mind is involved too much, then I go to the 1m or above 1m potency. Here we found the exact pathology is also not there. She have symptoms but reports are always normal. So that's why I start with the 200 potency in a single dose. After a month, the swelling is 80% better. She feels lightness in the leg. Heaviness is just because of the swelling is there. Because a lot of swelling is there. So constipation is 30 to 40% better. Leg pain, that is because of the injury, she fall there, so that is not there after that. And pimples on the labia majora is there, but discharge is reduced, the white discharge is reduced there. So when I got up to 80% result after first dose, I'm not going to repeat the medicine again. I'm just waiting for the for further follow up to see. On the next follow-up, what I got is the swelling on the leg is not there now, even after long sitting. As sitting is the part of her job, she used to sit for long, for afternoon to evening daily. So even after sitting, the swelling is not there. Constipation is 90% better. There is no pain which is there from the injury. Is no pain is there on the leg. and there is no pimple on the labia majora, and no pimple and discharge is there right now. And surprisingly, she reduces weight there, 2.5 kgs she reduces. uh, so again, put patient on the SL here, and after the second prescription, after second follow up, she doesn't come to me again. Okay, but on call, she told me that I am absolutely okay, so I doesn't feel to take medicine again, so that's why I'm not coming now. So this is how the case is closed here. Okay, so this is about the second case here. Any question, any doubt regarding this case?
Till now, we don't have doctor.
So
So,
may I proceed now then?
yeah, dear delegates, if you have any doubts, you can ask. We have one question. Why not Kali carb?
Kali carb. Okay, as we see on our first case, there is no indication of Kali group here. So that's why not prescribing Kali here. All the indications are there of Calcarea group, Calcarea carb specifically. That's why prescribing Calcarea carb here.
Okay, ma'am. And we have questions. Kali carb in 200, how many doses?
Single dose. I told here single dose prescribed.
Okay, and there's no more question. Doctor, I think we can proceed.
So this is all about the cases of today. Now we are going to see the Kali and Calcarea groups there.
Okay,
So let
doctor.
us, yeah, yeah. So let's start with the Kali group first. Okay, so as we know, this is the potassium. Kali is the potassium. So where we found potassium? Potassium is present in every cell. It's a normal constituent of tissues, especially muscles. So it's the component of nerve cells, and the main function is impulse transmission and its maintenance of muscle too. So having a major role in the maintenance of fluid and electrolyte balance. So this is where in our body the this is very high and important role of potassium is there in our body. So as I told about the periodic table, when I explain about the cases, so what we pick today as a topic is Kali and the Calcarea. So as I told them, okay, this is stand in the fourth row of the periodic table. So as we know about the periodic table, I'm just giving a small idea about the periodic table for the further better understanding. So, periodic table have 7 rows and the 18 columns. Uh, the the rows or the stages represent the stages of life, whereas the column represent the development of itself in the stages. The row one is the hydrogen series
Hello,
and row itself. Yeah,
doctor.
hello.
Sorry for the interruption. I think your
Okay.
voice is breaking in between.
Okay. Okay.
Mm,
Might be the
check.
range problem is there. Is it better now?
Yeah, 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 yeah. You can go. You can go.
Okay. Okay. So as we are talking about the periodic table, so there is seven rows and the 18 columns are there in the periodic table. So let's see about the rows. The first row is of a hydrogen series, second is of a carbon series, third is of silicon series, fourth is of ferrum series, we are going to talk about, and fifth one is of silver series, sixth is gold, and the seventh and the last one is a uranium series. So, in short, going to tell you the themes of all these rows for the better understanding of the next thing. The first row, there is a theme of existence is there. There is a issues are existent issue are there. Their main feeling is, do I exist or not? This is the main feeling of this first row. Second row, there is a theme. There is a theme of being a part with within another, and there is separation. The main feeling is I'm a part of something or I am a separate. If we see in the third row, there's a theme of identities there. Issues are related to the separation and the birth. There is a now in this third row, identity is developed. Now choices and egos are developed, which are not there in first and second row. Now when we see in the fourth row, the security and trust is the theme. The security and trust is the theme of row 4, and the issues are related to that only. The security in terms of money, finance, of house, job, health, and relationship is there. uh, if we see the fifth row, there is the theme of a creativity and the performance, and the issues are about facing the new thing, creativity and the performance. There is a feeling, I am safe but I need to explore new things. They are the creative people, they need to explore new things for the greater new ideas. When we see the sixth row, now sixth row, the issues are about
Hello,
taking
doctor.
up responsibility. Hello, yeah,
Hello, doctor.
yeah.
Doctor, our participants have requested that can you please explain again this predictable because
Okay,
your voice is breaking in between. So you can
okay, okay.
kindly explain the table again. Thank you.
Okay, I'm going to start with the starting
Dr.
about the
Vibha, I will
periodic
tell
table
you an
now.
idea. Okay.
Yeah,
You
yeah.
just cut the connection and just
Mm-hmm.
rejoin it. Okay. Just
Cut the.
leave the Zoom and just rejoin.
Okay, okay, and leave the meeting and joining again, like
Yeah.
that.
Yeah.
Yeah,
Yeah.
okay, okay, I'm doing. Okay. When I'm unable to leave the meeting.
Okay. 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 Dr. Vibha, can you share now?
Yeah, yeah, I'm sharing my screen. Just a minute. Is it clear? May I proceed now? Am I audible?
Yeah. Yeah. You can proceed.
Okay. So, going to start again with the periodic table now. So, as I explained in the cases about the theme of the of row 4, so I'm going to tell you the a small idea about the periodic table, how to understand it. In periodic table, there are 7 columns and 7 rows. Sorry, this is the 7 rows, and the 18 columns are there in the periodic table. Uh, the columns represent the stages of human life, while the while uh, the rows represent the stages of life, while the columns represent the development within the stages of life. So this is about this is how we can understand the periodic table. When we see the theme and the qualities of rows, uh, first row is called the hydrogen series. Second one is the carbon series. The third one is the silicon series. Fourth one is the ferrum series. The fifth one is the silver series. Sixth one is gold series, and the last one is of uranium series. So when how to get the idea that in the case key patient is belonging from the particular row, particular stage. So let's see the thematical how we understand the rows. So first row have the theme of conception and existence. There is an issue of existence, and the main feeling is, do I exist or not? This is there in the row 1. When we talk about the carbon series, the row 2, there is the theme of being a part within another and then separating. As this is called the birth series, this is also called the birth series. The main feeling is, I I am a part of something or I am separate. This is the main feeling of row 2. If we see about the row 3, the theme is identity and nourishment is there. The issues are related to separation and birth. Now the main feeling and the identity and the choices and the ego is developed here, which are not there in the first and second row. When we see about the row 4, the theme is about the security and the task. The security in terms of money, finance, house, health, job, relationship. This is the issues of row 4. The patient is talking about all these issues. If we see the row 5, the theme is of creativity and performance. The issues are about facing the new things, about creating things, about the performance, and the main feeling is I am safe, but I need to explore the new thing. As the people are creative, they need to explore the new things for the greater ideas. If we talk about the row 6, the gold series, the main theme is of a responsibility. The issues are about taking the responsibility, the need for power, and the need for responsibility. The main feeling is, what we saw in the row 3rd is about the identity, row 4 is about the security, and row 5 is about the creativity. Now in row 6, the the feeling is, I have identity, I am protected, I can protect myself, I am creative, but now I have to take leadership, I have to take responsibility now. So this is something which is upper than other rows, as this is the 6th row. And if we talk about the last row, the row 7, the theme is letting go, and the issues is feeling overloaded, feeling overburdened, held together and confined, as if under tremendous pressure and responsibility. And then the desire is to break free, to let loose, to let go. This is about in short about the rose quality of periodic table. So as we are talking about the row 4 today, so let's see the qualities of ferrum series, the row 4. They are very very duty conscious people. They are hard workers. There is the need for securities there. They are observed. They are observed, critical oriented people. They are task oriented people. They are very practical. They are not people those who are very emotional and taking decisions on emotions. No, they are very practical, and they are perfectionist, means they are doing work with very perfection. There are issues of money and house and health. They are routinistic people. They need a particular routine for the daily life. If we see further about the qualities of row 4, they need security and they are task oriented. Security in terms of, as I described, there is security in terms of money, relationship, house, job, and health. uh, there's main feeling that I know who I am, but safety is not yet developed. I can't safeguard or defend myself. As we see in row 3, there is no identity. There is so in row 4, identity is developed, but still the security thing is not developed here. And when we see Kali and Calcarea, lack of capacity to protect self is there. They are dependent on other. They are dependent people because there is no foundation till row 4. There is no foundation. If we uh, if we see the column 1, what we doesn't show, this is the column 1. So we are going to talk about the column 1 and column 2 today, as the topic is of Kali and Calcarea. So we are taking both these columns. So if we see the qualities of column 1, the struggle is not yet start to form because it's a very first, very initial column. So struggle is not started yet. They are very spontaneous in work. They doesn't think much to start anything. They are very impulsive. If a thought is there, they are immediately going to implant that without any thought. They are very simplicity is there, and they are very childish and foolish, means there is that identity thing is not that much developed here till. So they are very childish, and they are doing many foolish things there. They want to start something new, start spontaneously, what I told. If we see the keywords to identify in the case, the keywords what we found in the column 1 to identify a column 1, they depend like a child. There is lack of confidence. Their incapacity is there. They need support. They are thoughtless as they start things very impulsively and simply. So they are thoughtless. Now let's start with the Kali group of medicines. So when we see the keywords for the Kali, so there is simple, duty, principled, and rigid and family. These are the keywords of the Kali group of remedies. What we saw in the case of our. So by these keywords, we can identify a group, for surely a group, and to identify, to differentiate the medicines of the group. How can we do? Will tell you. If you see the features of Kali group, they are very principled peoples. They are very duty bound peoples. They doesn't like to uh, they doesn't like the undisciplined thing in their work and in their life. They are very reliable and stable people confident on him. If the boss is told something to the worker, he is for sure that if I told something to this people, for sure the work is going to happen nicely, with very proper manner, because they are very particular about the work. They are very principally and very duty boundly they are doing that work. That's why people reliable on them. People have confidence on them. They are the main of his own world. How to understand this sentence is, when we take the case, the person what are the issues about the patient is talking. The patient of Kali group is always talking about his own world. Means he is not talking about what is going on in America, what is going on with satellite, and what is going surrounding. He is talking about his family, his work. Means he is a person of his own world. He is not going to talk beyond that. They are the peoples with strong principles. They have their own principles and they are strictly follow that rules and norms of that. They have a very strong sense of duty, and this sense of duty is expressed by their work. Very task oriented people, task conscious people, very hardworking. They are the builders of society because they are doing work very nicely, so we can say they are the builders of society. They work steadily. Means it's not like doing work today and tomorrow it's not going to work. No, they work hard and steadily, continuously they are working. They are practical and pragmatic peoples. They are very practical. Means brain rules heart. Means they are in emotions, they are not going to take any decision or anything. They are very practical people, very responsible people, as they say, as they work. But because of this duty boundness and rigidity, because of the duty boundness, on one stage, after one stage, the rigidity is developed there, and they become dogmatic and moralistic and conservative. This is the something which is the negative part of this group. They are very close and reserved peoples. There is a tendency to hold on things. They can't express themselves, they can't spoke up things there. So on physical level, how this tendency of hold on is expressed, it's like physically they are constipation is there, and there is difficult labor is there. They are very down to earth people. if we if we see this task orientation, we found this quality in Firam group of remedies also. But the Firam task orientation is to get power, but in Kali's the task orientation is to support the family, because Kalis are the family oriented people. They work very hard to support family. As we for example, we saw in our case of Kali Urs, he started working at the age of 11 just to support the family. uh, Family is everything for them. In case taking, we get the issues related to the family, or a patient talking about the family more and only for the family. They are very routinistic persons. If there is any disturbance in the routine, they get irritated, and that is the very tense thing for them to change in routine immediately. Everything has to be in routine. Do not accept new things. If suddenly you told ki some guests are coming, they are disturbed, they are not going to manage the things like that. But if you prior inform that ki on that day the guests are supposed to come, they are preparing for that. So then they are behaving very nicely because they are prepared for the thing. They can't take the new things immediately. They are very particular, not tolerate new things. Sudden unexpected things are not tolerable for them. They are very optimistic peoples, they are very contentious peoples. Because of the duty boundness and the steadily work, the rigidity is developed. This is the negative side of Kali. And in this negativity, they become dogmatic, they more moralistic, conservative, etc. uh, in this negativity, they start punishing people instead of the helping them. Anxiety is felt in the stomach because vagus nerves are present there, and that produces the excess amount of STL. That's why in Kali group of medicines we saw the anxiety, the fear, the phobia, everything is felt in the stomach. If we see the characteristic of the Kali group, we see the stitching, pricking, tickling type of pain is there. The pointing type of pain is there. What you found in the Kali group of medicines. The discharges of Kali group are very specific. We see the ropey tenacious discharge, the watery or yellowish greenish discharge is in the Kali bicomicum. The corrosive discharge is in the Kali iodum. So this is what we the discharges are very specific. That's why I put this on as a table right now here for the better understanding. So if we see the time modality, which is very specifically present in Kali group, as 2 a.m. aggravation in the Kali Bricomicum, Kali Sulf 6 a.m., or Kali Nitricum 3 a.m., or Causticum evening or night. Or the general modality is they are aggravated after midnight and early morning. This is the generally aggravated. All this is for the old Kali group of remedies. Very interesting. See, if we easily we want to memorize the thermals of all the Kali groups of remedies, so we have to remember this thing only, that all the Kali group of remedies are predominantly chili except Kali sulf, Kali iode, and Kali bicomicum. So this is something which is a tricky thing to memorize the thermals of all the Kali group of remedies. Now let's see one by one thematically understanding of all the Kali group of the major remedies of Kali group of remedies. So the Kali hours. The theme of Kali hours is that the people who support the patient he sick cannot be trusted. They could even rob him. This is the main feeling. This is the main theme of Kali hours. And without family he is weak and dependent, yet have doubts as to whether this same family or group is trustworthy or not. What we found in the case of our Kalia's case of today. Physically the person is chilly, the aggravation is there on 1 to 3 a.m. A sudden noise throws the whole body into a terror. This is something which is peculiar in the Kali hours. Itching aggravated warmth, though the patient is chilly, although the warm thing is make them itch. This is something peculiar what we found in the arsenic Kali ars patient. Let's see the next remedy of Kali carbonicum. Kali carb is have a vital fear and reactivity, as this is the quality of carbon that is seen when a person lacks the support of a family or a group. So the see both the qualities of carbon and the Kali when get together, then we can say this is the Kali carb person. So physically, the patient is weakness in back ameliorated by lying flat on the back. This is the anti-sodic remedy, and there is aggravation at 3 a.m. And intolerance of cold is there and sweet desire. If you see the Kali phosphoric, Kali phos is the main feeling is I am not loved by the very family or whom I am dependent for the support. This is the main theme or main feeling of the Kali phosphoricum. What should be there in the patient to prescribe Kali phos? If we see physically, again the patient is chilly, craves sweet, hungry as soon after eating. This is the symptom of phosphorus and not the Kali, which is there because the Kali is attached with the phosphorus. Or sensitivity of physical state is there. If you see the Kali sulfuricum, there is a theme of Kali sulf is of being disgraced and insulted by the family or group whom support is seek. The physically the patient is hot, as we saw the three remedies of Kali group is only hot. So sulf is one of them. Sulf is hot patient, aggravated by warmth, amelioration by open air, even walking in open air. Yellowish discharges are there. There is marked craving for sweet, and as sulfur is there, so for sure the skin elements are also there. The eczema with thick yellowish discharge is there, especially when there is much itching aggravated at night. If we see the Kali iode, again, the as iodine is the hottest medicine of the materia medica. So this is the hot medicine thermally. This is the antisyphilitic, anti-tubercular medicine. And what we found thematically in Kali iode is that there is an idea that they have to do their duty to have a right existence. They are finding their existence. They work hard more than required, and so when they retire there is a problem because they have nothing to do, nothing, no work to do that. The extremely sensitivity of the parts affected is there. And the important modality was from sunset to sunset, and by drinking cold milk and after cold. If you see the Kali mood, the theme is to be a good mother. This is the feeling of miraticum, because what we can see, the miraticum is represent the mother part, and the carbon represent the father figure. So when there is a uh, when cation and anion mix, and when there is a miraticum part is there, so that represent the maternal part is there, the mother figure is there. So the main theme is the duty is to good mother and taking care of the family. And the keynote is there is a white color secretion and the tongue is coated white. This is what the keynote of the Kali Miradicum. There is catarrhal affections and subacute inflammation, inflammatory stages given rise to the sticky fibrous exudation there. If we see the Kali Bicomicum, which is a small remedy, there is an inflammatory process lead to plastic exudation, which is in turn tend to the formation of false membrane there. There is a shifting of pain rapidly. Tongue is broad, flat, and a large insulated patches are there on the tongue and takes imprints of the tip. And gastric symptoms include simple digestion to malignant affection is there in the Kali bicomicum. If you see Kali chloricum, again the small remedy. So the pathological things we are more reading in the small remedies. Ulcerative and follicular stomatitis, salivation become profuse, and there is acrid and offensive things is there in the Kali chloricum. The whole mucous lining of the mouth become red and tumid. This remedy it is not well proved. So this is the limitation things we have about the remedy only. We see the Kali cynatum. Specifically, this remedy is for the neuralgic pain, particularly felt in the temporal region, aggravated after a full meal and relieved by motion and in open air. There is slow breathing. This symptom comes out in most every case of the poisoning there. So this medicine is indicated to many affections and useful there. See the Kali nitricum. There is stitching pain anywhere, impending respiration. There is an inky black flow of menses, which are the indicating symptom of the Kali nitricum. Aggravation of all the symptoms from eating is there, from eating wine, beer, and wine is there in the Kali nitricum. If we see the spare of action of all the remedies of Kali group, what we found here is the Kali biocomicum have specific action on mucous membrane and throat with secretion of tough stringy mucus that adheres to the part. Means if there is a leucorrhea, it's hard to pull it off from the parts where the thing is stuck. This much the sticky thing is there, stringing thing is there. In Kali carbonicum, base of the right side of the lung is preference to the left. This is the keynote type of symptom of Kali carbonicum. As far as we see the Kali chromicum, the ulcerative and follicular stomatitis, for that the Kali chromicum is there. Kali iodine, if we see the patient who after an attack of syphilis has been overdoses with mercury. So Kali iodine work well after the element from mercury. If Kali muriaticum we see, there is affinity for the middle ear and ischium tube is there. For Kali force, there is a great want of nerve power is there for Kali force. If we see under Kali self, extensive distinction of the cells of the epidermis and epithelium is there in the Kali cell. So this is about the specific sphere of action of some remedies of Kali group. Let's see further. This is all about the Kali group of remedies. We saw the differentiation of all the remedies. We saw the discharges and sphere of action of all the remedies. Now we are going to start with the Calcarea group. So, is any question related to Kali group is there still? If any question is there, kindly read.
Okay, doctor. So, dear participants, if you have any question regarding Kali group, you can throw in the chat box. Please ask your doubt.
I think we have around 10 more minutes left. Actually, you can complete the session. Half an hour can take, Dr. Viva. You please go
Okay,
through the
okay,
criteria right now.
okay,
Okay.
okay. So
Okay.
let's start with the Kali group. So calcium is the major mineral element of our body, and it consists 1.5 to 2% of the body weight in adult human. In adult body, it contains 850 to 1400 gram of calcium, and the amount in blood is usually up to 10 mg. The main function is the formation and maintenance of bone and teeth. And the other functions are muscular contractility, regulation of neuromuscular reactivity, and coagulation of blood. So this is the major role of calcium in our body. So let's see the stage 2, column 2, as we saw column 1 before Kali group, as Kali is belonging from the column 1, and now Calcarea is from the column 2, row 4. So we are seeing the about the column 2. So this is the beginning to feel the presence of structure. What we found in the column 1, there is no structure is there, nothing is there. So here what we found, there is a beginning to feel the presence of structure, but it is a provisional stage, like a tent. This is not something which is permanent is there. It's like a tent which serves the purpose only as long as condition is optimal only. If things are little out of the way, then immediately one seeks a permanent structure. If you see the keyword of column 2, they need for the support. They are dependent people. They are timid. They are unsure people. They need protection. They need covering. They are very shy and lack of confidence. They are evaluating things, means they are seeing like, is I am better, or someone is more better than me. They are evaluating like that. Their incapacity is there. So this is the keywords of column 2. If we see the keywords of Calcarea group, so observed, fear, timid, and shielding, these are the keywords to find out the specific group, that is Calcarea group. So let's start with the constitution of Calcarea. The lines suited best to the Calcarea constitution are fatness without fitness and bones without strength. They are fatty, flabby, and obese. There is a congestion, which is the theme of the Calcarea. There is flushed face and red congested is there. If we see the features of Calcarea group, they are slow and sluggish, both mentally and physically. At physical level, how we see this thing on physical level, there is a lack of reaction, and there is delayed healing. There is delayed at mental level, they are slow learning and slow grasping is there. In children, delayed milestones are there, as because of the calcium deficiency, there is delayed teething is there. In adults, we found the dullness, lethargy, dwarfism, obesity. This all we found in the adults there. The main feeling of Calcarea is the security and stability, which is strongly Calcarea desires for company also. They are very submissive, they surrender themselves, they are not someone who stand for things and raise their voice. They are submissive, they are very dependent on people, they are fearful people. Decision making is something which is not a cup of tea of Calcarias. They are indecisive people. They doesn't take more risk. Means they are not going to invest something on some business or somewhere where the security is not there, where the surety of not there. They are not going to take that risk there. They doesn't cross their boundaries out of the insecurity. Protection, overprotected and wide well. When we see a Calcarea child or a Calcarea patient, what we found in the history, they are overprotected, over pampered child. They come from the over pampered family. So they doesn't have dare to do or to stand for something. The as we know, the source of Calcarea is the middle layer of oyster shell. So calcium offers protection not only to human in the form of bone, but in early form of life in the form of shell. So exoskeleton is prepared from the is made from the calcium. That's why it's lines. Other features, when we see, there is affinity of bone and glands, as there is deficiency of calcium. So bone affinity is for sure there in the calcareas. Bone are brittle, they are easily fractured, deformed, delayed ossification is there. There is hypertrophy and indurated glands are there. Congestion of arteries and veins and chest, etc. are there in this group. The foremost thing what affects calcareas are what other will say. What other will say, this is something which strongly affect the calcarea peoples. They are very anxious. They are anxious about the future, about the health, about the job, about the relationship. They are very anxious kind of people. If we see about the fear, there are a lot of fear, and almost every fear in the calcarea is there. There is fear of darkness is on the higher level is there in the calcarea. There is fear of responsibility. They are not someone who can take the responsibility and fulfill that. If we see, the obstinacy is there in the calcarea. See, obstinacy is something is calcarea which make them success, because they work steadily out of this obstinacy. They work very hard and steadily. That's why they become successful. They crave for indigested food. They desire for pencil, egg, milk, chalk, things which contain the calcium. They desire for that things because there is a deficiency of calcium. They averse for tobacco, for coffee, for meat, for milk. If you see the discharges, there is profuse white albuminous discharges are there, but occasionally yellow discharges are also. And if we see how to memorize the thermals of all the calcarea group of remedies, we can say all calcareas are chili except calcarea sulf and calcarea iode. So this is the trick to to remember the thermals of all the remedies, all the calcarea group of remedies. If we see the modalities, aggravation from mental and physical exertion is found in the calcarea carb, ars, calcarea causticum, calcarea fluor, iode, phos, and silicata. These modalities are something which are we mostly found in calcareas, and almost a large almost the large and the drug pictures of the calcarea where we can found these modalities. There is aversion to motion, there is calcarea carb and calcarea salt there. Lying down amelioration, calcarea carb, iode, force and salt is there. This is about the modalities, some major and the important modalities about of the group. If we see about the calcarea child, they are very slow learners. Lead development is there. Teeth are developed late. They crawl and walk late. Means all the things are delayed there. There is irregular growth with enlarged and hard lymphatic glands are there. They're very stubborn child. Means what they want on any cost, whatever comes in their mind. They're afraid of darkness and may wake up screaming from nightmares. So the nightmares of calcareas are very specific. Means there is some ghost is coming in the dream, and something is like that. The fearful kind of nightmares are there in calcareas. Uh, a very specific thing is the head sweat at night, which smells sore. This is very peculiarly present in calcareas. And no doubt there is lymphatic gland affections are there. There are hard lymphatic gland. There is irregular growth of with enlargement. There is fear of animal like mice and dog, etc. is there in calcaria child. They can go without passing a motion for several days. Means constipation is something calcaria is preferring to have constipation. Means calcaria enjoying constipation. If we talk about opposite thing of that, the phosphorus enjoying the diarrhea. They are not calcaria is not something which they are doing something to come out from the constipation, because they are enjoying that thing. They're not outspoken in the class. Means there is so much lack of confidence, so they are not talking that much, and a lot of fear is also there. Fear in talking also, fear to talk to people also. So they're very obstinate child because unable to use their mind. They are not using their own mind because they're incapable to use their own mind. They are prone to catch cold and cough, and swollen glands and tonsillitis and ear affection. In most of the time when we found the tonsillitis case, so half of the time the selected medicine is calcarea only. So let's see one by one all the medicines, how to differentiate calcarea group of remedies by one another. So the feeling of calcarea earth is I need people, but I cannot trust them. They may rob me. I may be cheated. I'll let down by the people on whom I depended from the protection. So this is the something which is a very major theme of the calcarea earth. If we see physically, there is breathlessness, there is desire for soup, palpitation from least motion is emotion is there. If we see the calcarea carb, the main feeling is the need of the stability and the security. Physically, calcarea carb is usually obese, but we can found thin calcarea carb also. There is not something which every calcarea person can be obese only. They should be obese only. No, we can find the thin also. There is a profuse perspiration, and because of the calcium deficiency, we can found the white spots on the nail of calcarea carbonicum. And there is desire. See, in desires, egg desire is there, meat and chicken and chocolate and sweet desire is there, indigestible thing desire is there, the things which contain the calcium, because desire is the need of the body. That's why person is desiring the thing which is lacking in the body. If you see the calcarea floor, the main theme is need for stability and the security is there. Physically, Calcarea carp is usually obese but can be thin. Uh, Again, the profuse perspiration is there, white spot on nails are there. Calcarea iodata. The main feeling is he may be terribly disappointed, betrayed, or hurt, or even starved by the people on whom he is dependent. So this is the main feeling of the Calcarea iodatum. As we saw, the two medicines of Calcarea are hot. One of them is iode, Calcarea iode. Usually, Calcarea iode is emaciated but can be obese. We can found that when prescribed correctly, obese Calcarea iodatum patient lose weight after the medicine. They sudden violent pain is there, and the thyroid affection is there in the Calcarea iode patients. We see the theme of Calcarea force. The main feeling is I am not loved at the place of security, and so I seek love elsewhere and come home for security only. So there is a feeling of not being loved is there. The main rubric what we found about the Calcutta force is the whom desire to go and when there go out. Physically, when we see the it craves condiments, growth affected disorders are there. Test bitter for water is there. In Calcutta silicata, if we see, there is a need to keep up to a particular standard to get the security and protection what they need. And we when we see the physically Calcutta silicata, there is a sweaty palm and soles, especially cold, and the sweaty fingers are there. This is something which is very peculiar symptom of the remedy. And another thing is the blue lines on the gum, which is very peculiar. There is suppurative problems like sinusitis, bronchitis with offensive discharges are there in the Calcarea silicata. In Calcarea serve, not appreciated at the place of security. This is the main feeling of Calcarea self. Example by parents and not valued. And not valued. This is also there in this Calcarea self. Physically, their desire for food and tea, hot patients, and desire for cold bathing, tendency of fungal infection and tinea and eczema is there, as sulf is there, so skin elements are also there in the remedy. When you see, let's at the end, let's see the some differentiation of the Kali and Calcarea group. If we see the source of both the medicines, the Kali source of Kali is the potassium components, and whereas the Calcarea is the middle layer of oyster shell. If we see the constitution, we know the fatty, flabby, and obese constitution of Calcarea is there, whereas in Kali, there is dark complexion, the fat, chubby person, heavy built is there, and there is tendency to obesity is there. Sclerofaction of Calcarea is on bone, and is of Kali is on mucous membrane. If we see the perspiration, Calcarea's perspiration profuse and sour smelling, and Kali's doesn't have any specific character of perspiration. There is desire for sweet in the Kali, and there is craving for indigested food or pencil, egg, milk, chalk, everything is there in Calcarea. Calcarea averse for tobacco, coffee, meat, and milk, whereas Kali averse for meat. If you see the discharges, there is a ropey, tenacious, tough discharges and stringy discharges in there in Kali, and whereas in Calcarea there is profuse white albuminous discharges, occasionally yellow discharges is there. If we see the thermals, predominantly all the Calcareas are chilly except Calcarea sulf and Calcarea iode. And in Kali, predominantly chilly except Calcarea sulf, iode, and Kali bro. If we see the side affinity of Kali, they are predominantly left-sided except Kali Kal, and Calcareas are predominantly right-sided. If we see the character of pain, so there is stitching, pricking, prickling, and pointing type of pain found in the calcarea, whereas in calcium, in Kali, sorry, in calcarea we got the throbbing, shouting, burning, and periodicity of the pain is there in calcarea. So this is all about today's presentation. Uh, Thanking to all the participants for their patient listening, and special thanks to the IHMA for giving the chance, for giving this opportunity for delivering my lecture here. Is any doubt or questions are there? Kindly read for me. Uh,
Okay, doctor. We have 2 or 3 doubts because we have already
yeah.
cleared cases doubts.
Okay.
So, difference between Kali.
Mm-hmm.
Okay, we can. Okay, difference in theme of Kali Foss and Calcarea Foss.
Kali phos and calcarea phos. Okay.
Yeah.
See, when we see any medicine connected with the phosphorus quality is always there. But how to rule out is, in Kali group there is a quality of Kali plus phosphorus. In calcium, in calcarea there is a quality of phosphorus plus calcium. So in calcarea qualities there is fear, there is insecurity is there. And when we found the Kali phos together, so the Kali qualities are there. They are duty bound. They are fastidious. Uh, they are family oriented. This thing we found in there. This
O-
is something which is easily differentiation of medicine.
Okay, doctor. Uh, then actually we discussed all the things.
Yeah.
We have a question. Calcarea group have aversion and desire for milk. How does it happens in case you prescribe the remedy?
How this? Sorry, repeat the question. I didn't got the question.
Okay, okay, okay. Calcarea group have aversion and desire for milk.
Mhm.
How does it happens in case? How prescribe the remedy? How to
Okay.
prescribe the
See,
remedy?
okay. See, when we got something, some specific modality or something desire aversion in the patient itself narrating you that I like milk. I am taking milk daily, but after milk I started diarrhea. Means there is a desire for milk also, and there is he is get affected by milk also. So this is how we can found in the case. So for both the things we can prescribe calcarea. Both the things are present in calcarea group of families. So patient
Oh,
is self narrating you this thing.
okay, ma'am. Uh, if all the symptom matches with Kali and Calcarea, but not the heat and chill, then what we have to do?
Okay, if we found the mental mind symptoms, which are exactly matching to your remedy, and if thermal and thirst is not matching to the remedy, you are going with the medicine which are matching your more important symptom like mental symptoms. So if mind symptoms are very prominent there of Kali or any remedy, and if thirst and thermal is not matching there, even though desire and aversion is not matching, you can go with the medicine.
Okay, ma'am, we have a 1 to 2 question more. Difference between Kali hours and Calcarea hours.
Okay, again, what I explained about the
Okay, okay.
phosphorus. So Kali Rs and Calcarea Rs. No? Okay.
Yeah.
So when we differentiate any medicine where cation and anions are attaching there, so whenever some medicine is attaching there, so we got qualities of both medicines there. So when we see the Kali Rs and the Calcarea Rs, so for sure the arsenic qualities are there in both the patients. So we have to rule out the Kali quality and the Calcarea quality. What I explained 2 3 times already. So this is easily differentiate. We can differentiate between this medicine.
Okay, okay. And the last question is, uh, calcium sulf metal matches and not the thermal. We can give a.
Sorry, I didn't got question.
I
Voice is disturbed
can't
there.
question
Kindly
actually.
repeat. Yeah.
Calcarea self metal matches and not the thermal. We can give a calcarea self.
Yeah, you can. You can. We can
Okay,
give it.
I think it's over.
Yeah.
So we can conclude.
Yeah, sure.
Okay, ma'am. So it was really a great session and with well-framed cases. And your methodology is really appreciable, doctor. So I
Thank you
think
so much.
everybody enjoyed it and well-framed presentation. So well explained and well wishes for the further session, doctor.
Thank you
And
so
we
much.
hope more sessions from you. And you're really a youth icon. So thank you so much from IHMA. And we invite you for the further sessions also. Thank you so much.
Okay, I literally like to thanks to all the group of IHMA, Dr. Deepu sir, Dr. Ranjit sir, and whole team to giving opportunity to newcomers also to explain their ideas on the platform. So thank you so much.
Okay, doctor. Thank you so much.
Okay, thanks. Good.